Can you all still hear us okay?
We can hear you.
Okay. I just want to, can you see the slides all right? What you should hopefully see right now is the title slide. Is that displaying for you okay?
Yes,
It is?
very good.
Okay. All right, so we'll go ahead and get started. If anything does happen along the way in terms of our audio connection or our video, um, either there's a chat feature in the GoToMeeting sidebar that you could type a message if we lose audio together, or if we do have audio and you're having video problems, please feel free to interrupt at any time, and we'll make sure that this is as good as possible for you all. And the session is being recorded so that if there's any issues in communicating right now, I can always have that link sent around so that materials could be viewed at a later time. Or if there's partners that weren't able to make this particular meeting in person, we can share those materials with them as well. So I'll go ahead and get started. My name's Adam Ballas. I'm with Public Health at West Virginia University, and we are, Cecil and I are very happy to be partners with you all and do what we can to make your efforts in chronic disease tracking, management, and prevention very successful. So it's been great to work with some of you individually in one-on-one sessions. We've really enjoyed that. And the technical support that we can provide, we felt very fortunate that we can start to do some hands-on work with individual sites and help to take care of some of the longer standing issues that may be there in terms of data collection, management, and sharing. So I know that we're behind a little bit in our time frame, so I'll do my best to catch us up to speed so that we can finish on time as scheduled. I wanted to again acknowledge the PCDC for all of the fantastic work that's going on, and also Gwen Hosey for helping to bring our office into this collaborative. We sincerely appreciate working with all of you, and our background is in health analytics and health informatics and research process and data management. So that seems to be a nice piece that we can bring to the team, but we really appreciate being involved, so thank you for that. I won't spend much time here, but about our office in West Virginia, we do a lot of data support to primary care centers and health systems. Everything that we do is geared around helping our partners have access to good data, good quality data that they can use for patient care and at times even research. So we do a lot of work across chronic diseases, risk factors, even things that are not chronic health conditions such as injury. So the point of all of our work is to ultimately help improve health outcomes. And we do everything that we can to help our partners step through that process of not just having data, but understanding what those data can tell them, and then move into some way of putting those data to good use in the clinical settings, and turning those data into actionable pieces of information that can ultimately help patient care. A lot of the work that we'll talk about today ultimately comes back to that PDSA cycle, the Plan, Do, Study, Act cycle, which I'm sure that you're all familiar with. And there's some very basic questions that go into that cycle. So in terms of tracking data, whether it be in CDEMS or PECs or any other system that you might be using. Oh, I should have, thanks Delphine. Would you mind, I should have asked whoever's at the laptop to advance the slides. So um, I was on, I apologize for that. I'm on the fourth slide right now. The title of that slide is Model for Improvement. Could you let me know whenever you're there also?
This is the second one. Okay.
Are you there?
Yes.
Okay, great. Thank you for that. So as I was saying, and I apologize that I forgot to ask for the slides to be advanced. Um, all of the data work that you do, whether it's in CDEMS or PECS or an electronic health record, in the end, it's about having the ability to understand your patient populations better and to make good decisions. So all of those things are grounded on some basic questions, such as, what are you trying to accomplish? How are you going to know that a change is an improvement? And what kind of changes can you make that will result in improvements? All those major questions can be addressed through that PDS cycle, which we'll look at more carefully. Um, so in order to, the PDSA cycle starts with a plan, right? So in order to have a plan, you're essentially responding to, oh, would you mind advancing the slide, please? So that this current slide is PDSA cycle. That's the title. Let me know when you're there, please.
Adam, it doesn't move.
It's not moving. Um, okay. Usually whenever I try to advance the slides, one of the arrow keys does the trick for me, either the down arrow or the right arrow.
Okay. Okay. Is this the PDSA cycle plan to study at?
Yeah, thank you. Thank you, thank you. Um, so I'll
Fine.
make it a point to say next whenever we're ready to switch, okay?
Okay.
Okay, thank you. Um, so for every step of that PDSA cycle, you need good data to rely on. Um, so those small tests of change are really focused on, maybe larger issues in the end, but smaller components of those larger issues that you can sort of break down and tackle. So in order to develop a plan, you really need to know what your data are telling you currently. So those registry data, again, whatever system you happen to be using, will be able to ideally tell you what are those priority areas in your clinic that need to be addressed. And then based on your data and communication with your healthcare team, you can identify what needs to be done to address that issue. And then, continue to track your data in that registry, study the results over time, and then see if those changes in the plan made any impact. And so the cycle continues really over and over until you, in the end, have a success. So there's really no, in my opinion, there's no critical time frame for a PDSA cycle to be successful. It is a continual cycle where you take a look at your data, try doing something new or different in your practice as resources and time permit, and then evaluate those efforts to see if they made any impact. And if they didn't, try something else. So it continues until it improves, which I think is very realistic for the busy practices that you will have. So next, please. The next slide should read clinical information systems. And please let me know when you're there.
That's it. Adam, can you view it via your outline so I can just go to the frame or the slide?
I'm sorry, I couldn't quite understand that.
It's okay. Came out now.
Oh, okay, there must just be a little delay there, huh?
Uh-huh.
Okay, okay. So this is a term that you've certainly seen before, but clinical information systems, that's part of the care model. It's very much fundamental to the PDSA cycle. In my opinion, that's just a fancy term for a patient registry or even electronic health record. So that clinical information system is simply a program, software, that's designed to collect, store, and make data available that are important to that healthcare delivery process. Some of you do use CDEMS, and that's one system that's out there for use. And other health systems may still use PECS, and that's another system for use. And we have a lot of primary care partners here in West Virginia that use electronic health records. And hopefully those EHRs or electronic health records have registry functions. Sometimes they don't. But suffice it to say, there are lots of different systems out there that are being used to track data. If you could go to the next slide, please. The next slide is about CDEMS. Are you there?
Hold on, not yet. I'm just going to open Okay. Go ahead.
Okay. So CDEMS is one of the options that's available for collecting data. And it has some definite strengths to it. First, it's a free software and it's open source. So it comes from a public health background. So that's awfully important and rather refreshing in terms of data systems. So as our partners have additional uses for the registry in mind, we're able to modify it to fit their needs, or as they have ideas for additional features or functionality that it should have, we do our best to make those modifications available. So strengths, it's customizable. And one of the earlier learning sessions that we covered was on CDEMS progress note. So it can be scaled up and scaled down based on measures that are important to your practice. So it's modular. That is, additional apps that are requested, we can build those in to suit our partners' needs. And important to our work in West Virginia is that we can import data into the system. We've maintained CDEMS registries based on data from other registries, practice management systems, electronic health records, and also laboratory companies. And for diabetes, for example, a lot of the measures that would be tracked are based on laboratory values. So HbA1c, cholesterol, triglycerides, HDL, LDL, a lot of those values sometimes are already in an electronic format that we can import into the registry. So it saves our users a lot of time and energy in maintaining it. So those are some definite strengths of CDEMS. So I'm going to go to the next slide. Let me know when you're there. This one is called CDEMS as part of the improvement model.
Hold on. Okay, go
Okay.
ahead.
Okay. Thank you. Here's really the crux of the session. There are three major points in time where the registry can be used as part of the care process. And that's pre-visit planning, at point of care, and then post-visit for evaluation and additional planning. So I have three slides that follow, which take a closer look at each of those points in time. So I'm going to go to the next slide.
Go ahead.
And I'm as close to the microphone as I can be. I guess there might be some feedback here or there. I don't know what more I can do on my end, but if there is something that I can do to make the audio better, I'll certainly try.
You can go ahead, Adam.
Okay, so this is the slide on pre-visit planning. So I organize these slides in terms of things that you can do with the registry to support data use along each of these three steps. So prior to patients coming in, there are very in-depth summary level reports that are available to run by health condition. So if diabetes is your focus, you can have summary reports run in advance showing you your entire patient population. You can run those same reports by healthcare provider if you happen to be wanting to do data on your own specific patient population. You can also run lists of patients in need of specific services and lists of patients with laboratory values outside of specific care guidelines that you have in place. So prior to patients coming in, you can have a good global look at your patient population and then start to drill down more closely. See, okay, so here's my patients coming in this week. You can know in advance, here's everybody that needs an eye exam, needs a foot check, needs an HbA1c, whatever those values might be, those metrics that you're wanting to track more closely. So I'm going to go to the next slide. Let me know when you're there.
Very good. Point of care.
Okay, thank you. So at point of care, the registry offers progress notes to display the current medication that patient's taking, their health conditions, services that they've received or not received, tests that they are due for at that point in time. So that progress note is very well equipped to highlight what that patient needs as they're there in your practice. We also have flow sheets that will display both current and historic medical information for patients, and also stoplight letters. So in a green, yellow, red display, it'll show you their current and most recent medical information relative to care guidelines. I'm going to go to the next slide. So this is post-visit. Let me know when you're there.
Go ahead.
Okay. So the post-visit evaluation and planning is really a combination of the two steps that we just went through. So post-visit, maybe once a week, once a month, whatever time frame you and your team have identified as important, you can start again with that summary level reporting by health condition and start to triage outcomes in that report that are the most pertinent for patient care. Maybe it's HbA1c outcomes. Maybe it's ensuring that patients by health condition are on appropriate types of medication, or making sure that your patients with diabetes are getting foot checks. Whatever that might be, start with what's important to you and then again move deeper into the data and find out of those summary level reports, who are the patients that are making up those statistics. You can generate call lists to call patients, remind them to come in. There's reminder letters. There's a lot of good patient-level tools that you can use at regular intervals to help identify and prioritize patient care. It's important to you all. And additional activities that you can do with your data, our office is available to help with any and all of the activities that I'm describing. But you can also do patient cohort or patient panel that if you are trying one of those small tests of change, a PDSA cycle, with not your entire population to focus, but maybe a smaller group, and you want to track 10 or 15 or 20 patients, whatever that might be, over time, in addition to the other tracking, we can set up the registry reports with you so that that's very feasible. It doesn't take much effort to run at regular intervals. So I'm going to go ahead again. Let me know when you're at the next slide.
Okay.
All right. So just retaining that PDSA cycle as a frame of reference for data use is always a good idea. So monitor those tests of change, however small or big they might be. And over time, you'll also be able to see, if you haven't already, are the right data being collected? Are we collecting too much? Are we collecting too little? Do we need to add measures to the registry? And are we seeing the changes over time that we want for our patient population? And as things work and as things start to really click and gel in your practices, you can even work on developing practice or policy changes that, whether they be written or verbal, those more lasting. It has a way of helping things last longer if it is a practice or policy change that we found something that works, it's working consistently, we're going to do that and keep it going over time so that our successes are more successful. I'm going to go to the next slide. Let me know when you're there.
Go ahead.
Okay.
Go ahead.
All right. So I was fortunate enough to get a progress report of highlights on successes and activities for the past year for Palau. So I wanted to include some of those great highlights in here as an indication of the good work that's going on. If you could go to the next slide, please.
Go ahead.
Okay. So, and if Edelyn is in the room, or Cecilia, or I'm not sure who all is there, but if there are other folks in the room that would like to speak to these points, by all means, please do. I'm definitely new to these points, but I'm very impressed by the progress that's being made, and so I can help kick off discussion. But if there's somebody else better suited to cover these, I will happily let that happen, or I'll keep going.
Keep going.
Okay, I will. So the Palau. So you've got over 40 members and 5 working groups looking at disease-specific issues for metabolic disorder, tobacco, alcohol use, physical activity, and nutrition. Those are huge issues, and I think it's great that you have that many people involved. And it looks like using that PDSA cycle, from what it seems to me, that you have a more regular process you can put in place for not just for having those meetings, but also putting those data into quality assurance, quality improvement, and reporting. It takes a lot to get those sorts of meetings together, and kudos to you all for doing that. I'm going to go to the next slide.
Okay.
Okay. So, again, just these highlights. This is about the clinical information system portion of Palau's activities. But it looks like there's a new process for tracking CDEMS for more timely data submission and use of the progress note. Um, and it looks like CDEMS use is becoming more widespread by all physicians in Palau National Hospital. I hope I'm pronouncing that correctly. If I'm not, I apologize. And some other outreach locations. The next steps are very interesting to me. If there's something that our office could do to be of support to some of those next steps, we would be glad to. It looks like there may be some issues with data management or quality. We've got a lot of experience in looking at CDEMS data to help with data quality and completeness. That's something we can certainly help with. And if there's any need for training, we'd be glad to help develop materials for that. So I'll go to the next slide. This one is on challenges.
Go ahead.
Okay. These challenges are very familiar to, I think, just about all of the health systems we work with. There never seems to be enough staff. And there is a shortage of staff. Data management does take time. And again, if there's something that we could, some sort of support or guidance that we could offer in terms of office flow for data management, we're always glad to talk with partners. And it looks like there's some issues with medical records, different charts perhaps for one patient. Again, that's something that we can help clear up as you all like. And if there are other health conditions that need to be tracked or organized in the registry for patients that have comorbid conditions, we could help set that up so that the flow sheets, progress notes, reporting, etc., are following a more complicated series of metrics rather than just diabetes. Next, please.
Oh, go ahead.
Okay. This list of successes, I'll admit I don't have enough background to do justice to, but suffice it to say, it looks like as the offering, as the available services expands in these health systems, the use of CDEMS seems to be expanding along with it, which I think is a fantastic success. Chronic kidney disease and staging of that is going to be included. I'm sounding like a broken record, but you know, a standing offer from our office to you all is that as you have needs or interests in modifying CDEMS, we'd be glad to help train you all, or whoever we should be talking with. Very glad to help do that and help make those modifications. And next, please.
Go ahead.
Okay. So I think we're just about ready to wrap up, and I think that we're pretty close to being on time. Not too bad. This one I did want to say again, a sincere thank you for the opportunity to be partners with you all. Hopefully you can tell from our talking with you here that we really do want our support to be directly relevant to what you need in terms of data tracking and reporting. And we have been learning a lot from you all, and we want to continue to learn from you. The one-on-one technical support seems to be going quite well, and I think that we've been getting past some challenges that have been long-standing, and it feels great to be able to contribute to those and to help resolve some issues that have been sort of barriers for quite a while. So we're here for any support that you might need for implementation, training, reporting, modifying the registry to meet your specific needs, and also to help set up the identified data sharing There is a feature in CDEMS that makes that easy. It's there's a button in the utility tab in the application, and I can certainly show any folks where that is and how to use it. But we just learned from partners today that there are now de-identified data sharing agreements coming into place with RMI, Palau, and FSM National. So that's fantastic. And whatever our little group can do to help make these things flow and to help make the process smooth, we are here for you. So next slide, please.
Go ahead.
Okay. So this is the fourth learning session. All of the materials that we've covered to date are available on a content management system, the learning collaborative system called Wigio. If you don't have access to that and would like access to the session resources that we have to date, please let me or anyone there know that's familiar with it, and we'll make sure that you do have access to it. But that's been a fairly good tool so far to help share files, have a common calendar, to be able to have online discussions, just basic content management tools that are handy to have in a collaborative such as this. And we're also making all of those resources available through another mechanism. There's a downloads link on this slide where shortly after the session is over, we'll post this session and all of the other materials also, so that everything is in one place for download. And as time goes on, we'll continue to update the file that download link goes to, so that the materials stay current. So next, please.
Go ahead.
Okay. So our contact information is here on this slide. I hope that you can see it. If there's ever a time that you'd like to communicate with us, whether it's over Skype or email or whatever happens to work, we are happy to do that with you. And there's just one more slide at the end, so if you would go one more for me.
Okay.
Okay, these are some, I just love these photos, so it was a great way to close. And thank you, Edelyn, and for sharing some great materials with me. So we're very, very glad to be partners with you. And hopefully this was an informative session for you. We appreciate your time and partnership. And as there's ability or interest or opportunity to do some one-on-one support with you, please keep us in mind, and we'll be glad to do that with you and make some good progress together. Thank you.
Did you hear the applause?
I did. My goodness, you're all very, very kind. Thank you. Yeah, if there's any questions, we'll be glad to field those.
If not, then we can take our break now and then we'll find our petition.
Those of you that have worked with ads, this will your technical support, doing the one-on-one. It's a lot harder. You do Skype, you find ways to host your computer and track on your computer and how to use that, how to use that. It's successful.
Before we take Start break, the PM.
Adam, are you still on?
Yep.
Anyway. Person on. Oh, thank you. Adam?
Yes, I'm here.
Adam?
Yeah.
Are you still there? Hold on.
Can you hear us okay?
Yeah, we're good. Thank you.
Oh, thank you. We really appreciate being involved. Thank you so much. We'll log off now.
Adam?
Yes, we're here.
Sorry, I don't know what's going on. I cannot.
Can you hear us?
And I'm just checking. Even the chat is not working anymore.
Oh, it's not?
There you go.
Okay.